Hi, my name is Nikki Zhao. I am an undergraduate student studying information computer science at the University of Hawaii at Manoa, and will be going into my fourth year this fall. Today, I will be talking about mobile applications and how they are currently shaping the world of healthcare today. So first of all, what do we need to use mobile applications? Smartphones. This chart represents the adoption and usage of technology over time, measured in percentage of US adults. As you can see by the light green line labeled "Own a smartphone", the adoption rate of smartphones began to surge starting from 2011 up until 2016. The percentage of US adults who own a smartphone increased by 42% in only 5 years. Now take a look at the topmost blue line labeled "Use the Internet". Starting from 2000 and ending in 2016, the percentage of US adults who use the Internet has increased only 36% in 16 years. As you can see, the percentage of US adults who own a smartphone has a growth rate 4 times larger than that of internet use. Furthermore, the amount of US adults who own a smartphone has already surpassed the amount of US adults who have broadband at home, as well as those who use social media and own a tablet. In short, a lot of people have smartphones. Now that we know how prevalent smartphones are, I will now cover all the most successful apps in a variety of categories within healthcare. First off, we have the American Red Cross apps. These apps are the most successful regarding point-of-care aid on a consumer-based level. The First Aid app, pictured to the right, is a comprehensive app on first aid, containing information to both educate and aid in emergency situations. This app is really helpful because it gives step-by-step instructions for many different emergencies, such as burns, allergy attacks, and more. It even has quizzes you can take to test your knowledge. Next, we have the Blood app, the perfect app for blood donors. It allows users to schedule and modify blood donation appointments with the American Red Cross, and even keeps track of history for you to look back on. The American Red Cross also offers a first aid app specifically for pets, functioning similar to the first aid app I went over previously, but has vet-approved information for pet owners. And lastly, we have the Emergency app, which covers 35 different disaster scenarios, including information on how to prepare for them and what to do if you find yourself in one of these scenarios. There are also apps for individual scenarios, which include tornado, hurricane, earthquake, wildfire, and flood. These apps include more in-depth information on their respective scenarios, even including live monitors and warnings specific to your location. Epocrates is one of the most beneficial medical reference apps used by over 1 million physicians worldwide. It includes an extensive drug database to assist in fact-checking details about specific drugs, as well as a drug interaction checker to make sure there's no adverse effects between the drugs you're prescribing. Also, there is a pill identifier that will identify pills based on physical descriptions or picture. There is also a very convenient calculator for quick calculations of things like BMI and GFR. In the Plus version of the app, which is currently a $175 annual subscription, there is an ICD-10 code lookup database, as well as an alternative medication database. Both are very convenient and useful resources. Lastly, you additionally get all of the clinical treatment guidelines. All of this information right in your pocket. Featured in the New York Times, on ABC News, and more, GoodRx is a consumer-based app for saving money on prescriptions by price comparisons. It contains an extensive and frequently updated database of prescription drug prices from over 75,000 different pharmacies. As you can see in the image on the screen, it even includes distance away from your current location, as well as coupons and discounts you can use to save money. Next, we have CareZone, a medication management app that holds a personalized, comprehensive list of your medication. This list includes dosages, date and time, progress tracking, reminders, and even a cloud-based sharing function. This sharing function allows loved ones to keep track of your progress and can help remind you about medication. CareZone is also extremely secure, complying entirely with HIPAA regulations, and all data is encrypted and backed up frequently at multiple locations. MyChart is a personal health record app developed by Epic Systems Corporation, developers of the electronic health record software Epic. It allows users to schedule and edit appointments in real time, track medication and instructions from your doctor, and even review live test results. It also includes family sharing, allowing your family to view instructions and test results from your doctor, if you so choose. Having a built-in email function, you can better communicate with your doctor about your health. Recently, a feature has been added that allows syncing with Apple's Health app, enabling live import of health data such as heart rate, physical activity, blood pressure, and more. Doctor on Demand is a telemedicine app that enables users to have live video consultations with a wide variety of board-certified doctors. This app really saves the hassle of having to come into the clinic to get diagnosed and can be a lifesaver when you're busy. Doctor on Demand is perfect for diagnosing symptoms in which you aren't sure of the severity of. There is also an option for private psychology sessions, and visits are on a pay-per-visit basis, but can be covered by insurance. Essential Anatomy 5. This is a learning app that uses 3D visualizations to enhance learning of the human anatomy. It includes 11 complete systems, male and female body types, 8,200 structures, and boasts 1.1 million users per month. The models are extremely detailed and allow for toggling of different systems and structures for more focused viewing. It also includes interactive quizzes, one type that is a unique drag-and-drop quiz, prompting the user to match the name of a structure with the visual model itself. Doximity is a social networking app specifically for healthcare professionals, allowing users to use secure messaging to communicate with colleagues from all over the world. It is used by 70% of US doctors and uses the highest end HIPAA-secure encryption to ensure maximum security. It even includes an electronic faxing function that allows users to send and receive faxes with the ability to electronically sign documents as well. Lastly, users can get the latest news and articles, and better yet, earn Category 1 continued medical education credit along the way. MyFitnessPal is a consumer-oriented calorie counter app that helps users to manage daily calorie and nutrient intake. With more than 5 million foods in the database, as well as weight progress graphs, this comprehensive app is the ultimate dieting companion. The app gives warnings for nutrient intake based on daily values, limiting you from taking too much sugar or fat, and encourages vitamin-heavy diets. Completely personalized, your diet is based on your own exercise habits, lifestyle, and most importantly, your body. Lastly, we have Fitbit, an activity tracking app that helps users accurately record and monitor their physical activity. Smartphones now have built-in accelerometers that can act as pedometers to measure steps taken and miles ran, but users can also pair this with Fitbit's wearables to more accurately track information. The app will calculate and record pace, calories burned, distance, progress, heart rate, and even sleep. The interface is also very clean, boasting a high readability of information. Limitations. So the advent of the mobile application era also comes with many limitations. First and foremost, security is the biggest limitation. Health data is extremely valuable, and making the data mobile only increases vulnerability. If a device were to be stolen and hacked into, the information leaked could lead to incredibly disastrous outcomes. Secondly is the digital divide. The digital divide is essentially the divide between two populations, those who use technology frequently and those who don't. Sadly, those most in need of care, like the elderly population, are typically less adept at using technology. Thus, all the money being put into the development of multiple applications is not being utilized by this population. Also, adoption and awareness are a big limitation in that a lot of providers and patients are not aware of these new apps. As awareness increases, more industries will realize how powerful medical applications are in enhancing healthcare outcomes. Lastly, hardware is a limitation. Smartphones have come a long way, but there will always be room for improvement, and with more improvements and features will come more innovation of mobile apps. So the future. Currently, this is still just the tip of the iceberg, as there is so much more room for innovation. Smartphone technology and usage is rapidly advancing, meaning that the potential for mobile apps will only increase. However, there must be diligent practice by both providers and developers to not fall behind with the newest tech. For example, Bluetooth usage seems to be relatively unexplored and could be potentially utilized for monitoring chronic illnesses, possibly even paired with other technology. So in conclusion, smartphones are essentially everywhere and will become even more prevalent as time goes on. The mobile forefront is filled with untapped potential and hopefully will be explored more in the future. To recap, currently, mobile applications are helping in fields of point-of-care aid, medical referencing, saving money on prescriptions, tracking medication, managing personal health records, telemedicine, learning, communication, personal fitness, and so much more. In the future, this list is likely to grow immensely as technology evolves and new apps are invented. Hope you enjoyed this short overview of the mobile applications being used in healthcare. Thank you for your time.